If you're experiencing lower back pain, it's my job as a pain medicine consultant to help you understand why you're experiencing this. This explanation is crucial because often managing back pain is a lifelong condition. Lower back pain is very common and can be severe and incredibly disruptive. It can affect your mobility, your ability to drive, your sleep, and your social life. The most common causes are arthritic changes in the spine and weakness in the muscles and ligaments in the lower back. You may have had a scan of your lower back, but not everybody needs one, as it often doesn't change how we manage or support you to self-manage your pain. We'll talk about something called red flags, which are symptoms that suggest major compression on important nerves, and if these occur, you usually have to go to the emergency department. These red flags include unexpected changes in your bladder and bowel habit. Your consultant will talk through what painkillers you can use and the potential benefits they may have. However, all medications have side effects, and these can sometimes be more significant than the benefits they provide you. If that's the case, they may suggest reducing or stopping some painkillers. Some drugs are not recommended for back pain management, and these include morphine-like drugs. Injections can be useful for some patients with lower back pain, but there's little value in repeating injections. Indeed, the national guidance doesn't recommend reliance on injections for long-term back pain management. We may talk about referral on to our surgical colleagues, but often we find that people can manage their lower back pain with advice, mobility, and appropriate use of painkillers.
Staying active is crucial as this helps maintain flexibility in the lower back muscles and ligaments which support your spine. As not all back problems are the same, your physiotherapist will work with you to develop an exercise regime to help your individual situation. We will be realistic with what we recommend, but staying moving is key to managing back pain. So it's important we come up with an exercise plan that you can do even on days when the pain is at its worst. When we experience pain for a long time in one part of the body, it's natural that we move this painful area less. The problem this creates is that the muscles and ligaments here get tighter and weaker, eventually causing the pain to worsen. Then, when we start moving the area, we're using tight muscles that don't want to be moved. For this reason, initially, the pain can feel a little worse, but we must get those muscles moving, and we can do this safely. So it's normal to have fears that further activity will trigger pain, but we will support you by gradually exposing you to a level of activity that's appropriate. The aim of physio is to give you more control over your pain levels. Although for most people, getting rid of the pain completely is unlikely, we can help you function better and improve your quality of life whilst living alongside your pain. We'll work closely with you and support you through your sessions, but we can only guide you. You have to do the hard work. Persevere and you'll get the benefits. There is a form of exercise for everyone, and although there is an element of trial and error, we will get there.
You may be surprised to be referred to a psychologist for pain management, but rest assured, it's not because the team think that your pain is imagined or not actually physically felt. We know the pain is real and that its impact can be distressing. In turn, increased distress can lead to more fear of the pain and more focus on it. This is one of the reasons that back pain and mental health are linked, so it's important we look at both aspects. Patients typically say that the back pain is less of an issue when they are doing something they enjoy. This is partly because when our interest is grabbed by something pleasant, pain is unable to demand our full attention. Conversely, when feeling depressed, the pain may prevent them from doing what they enjoy, so there may be more time to focus on the pain, as well as an increased propensity towards thinking about this. Furthermore, lifestyle can feel very different to how it once was, with people feeling disconnected within areas of life they once very much valued. To help, a psychologist will explore how back pain is affecting your physical and emotional life, identifying how both your thoughts and behaviours may have changed as a result of the pain, including how it affects your relationships and your sense of self. Finding ways to understand and manage emotion is individual and unique and can be a challenge in itself, but it is also an integral part of pain management which the team will support you with.
I've had lower back pain for 30 years and I've had injections, tablets, physio, scans, you name it, I've had it. What I eventually realised was that this pain was not going to go away. I made the decision that it was not going to stop me living a life. That journey though took years and there were many bumps along the way. I had to change my job, I struggled with the exercise part, I put on weight and I got really depressed. When I saw the physiotherapist, I mentioned swimming as my back always felt a little better when I was in the pool. We started to work on stretches and swimming and it really helped. It didn't get rid of the pain and it seemed to ease it. It certainly wasn't getting any worse. I stopped some of my painkillers as they were making me constipated. They didn't do much anyway, so I didn't miss them. I don't go out with my friends and family as much as I would like because my back pain makes car journeys difficult. So now I make a habit of walking to the coffee shop for a chat once a week. I need to take it easy. I build in breaks to my day and plan a bit more, but you can do it.